Navilas technology allows planning of lasers with a fluorescein angiogram and then eye-tracked deliverance of your targeted laser. What that allows you to do is a couple of things. One, it eliminates the inevitable human interaction between patients moving or doctors moving, which allows you to target pathology that is too close to the fovea that you may otherwise be too dangerous to treat. The second thing it does, it lets you treat pathology that you literally can't see or focus on with standard lenses. Microaneurysms, only about half show up on ophthalmoscopy. You can treat the other half that are only seen on fluorescein angiography, or treat pathologies that you see on an ICG or an OCT. From the staff perspective, it's very easy to go from taking the pictures and then importing. From a patient flow perspective, other than the patients commenting about how cool it is that they don't have a lens on their eye and that how quick this is and how it's less pain than the other lasers, it really speeds you along in the clinic. The only extra time, sort of their accolades, amazed at this technology. For the Navilas 577, the new Navilas has a much smaller delivery head, so you're able to see the patient and interact better with the patient. As well, on a PRP, you can hold the lens and get it much easier than the old delivery head. That brings me to one of the most patient-friendly factors, is that for macular lasers, you don't use a contact lens. And so patients that are used to the goop and lens on their eye are amazed when they're sitting there just staring at you, and the eye tracker's tracking their eye and delivering the laser precisely where the surgeon wants it to go. That's your retina, those are the little laser spots. We're gonna let this work. We're gonna give it, a couple, 3 months to kick in, and let me see in 3 months out in the other clinic, and we'll go from there. So one of the patients I did today had previous Pascal laser for branch retinal vein occlusion with a lot of ischemia. On fluorescein angiography, she had marked ischemia going almost to the fovea, as well as, interestingly, 2 macroaneurysms. The treatment with the paint of the PRP was able to very quickly deliver this pattern in a very even grid laser, much more even than you could ever get. It also was able to treat the macroaneurysms with single pulses just to the macroaneurysm, not having to laser around it. Both quicker and in a unique way than you could ever do with traditional laser. We're done. That was it.
Are you kidding? That's amazing.
That's cool. It's a cool technique.
The first one was the first laser I'd ever had. Didn't know what to expect at all. And I was a little bit worried about it. And it felt every time he pushed the button, it was like, I did feel something. And I really didn't know what to expect this time. This time I didn't feel anything.
That's great.
Felt nothing.
That's wonderful.
It was really, and it didn't take long at all. Last time I think I don't know how long it took, but it felt like an eternity.
An additional patient I did today had central serous. It's been a month and they have a leak that is pretty close to the fovea but not subfoveal. I was able to do guided laser right to that leak. We think it's a very good indication because it allows you to hit things on the fluorescein that really, with a traditional lens on the eye, you're kind of guessing where that leak is. This is very cutting edge, avant-garde treatments. And you would think with all this level of sophistication of the eye tracker, the computers, you'd be like driving an Italian sports car where it never worked. However, it's incredibly dependable. And when you do need software support or software updates, ODOS has been very good at delivering those. It's really been a delight to use, and ODOS has been great in their support team. And you do pay a small premium for it. Used to be a very large premium. And I think as more and more surgeons use it, they're going to be at a point where they have to have this.